Hi, I'm Dr. Danielle Walker. I'm a professor of public health and health science and the director of lifetime wellness at Biola University. I'm also a certified health education specialist and a co-founder of Meeting Tents.
And I'm Joey Walker. I have 10 plus years experience in a leadership pastoral role from churches from 300 to 3,000 people. I'm also co-founder of Meeting Tents. Meeting Tents is a global health organization. Our focus is to mobilize communities to thrive. We use data-driven public health models to guide us in identifying and addressing needs. We are collaborative in nature and value many different fields coming together to strengthen communities.
Usually we work in other countries, but this pandemic of COVID-19 has really opened a lot of doors for us to help across the country. And our hearts have really gone out to churches and pastors and really thinking, how can we equip pastors to reopen after this pandemic? And we wanted to create this video to help walk you through some discussions and topics and new guidelines from CDC so that you can feel equipped and prepared to open your church to provide a safe environment for your church members and staff, but also follow guidelines. I just want to take a minute and walk us through the basics of COVID-19 and what the symptoms are, how it's transmitted, and who's at high risk, because that'll be important as you reopen your church. So COVID-19 is a disease, and it's an upper respiratory disease. So the most common symptoms are cough, shortness of breath, fever, and there's a wide range of symptoms. So it might feel like a mild cold or more severe. There are actually asymptomatic cases that are testing positive as well, but recent studies have showed us that the people who are transmitting this disease are those who do have symptoms. The CDC and the World Health Organization both still say that this disease is primarily spread by those with symptoms and coming in close contact with them. A recent study was just released and peer-reviewed with a good sample size that showed that asymptomatic patients were not transmitting this disease even to those people living in their households. So it's really important to remember that there's no evidence to suggest that this is floating around in our air vents, and that it's really that close contact with those who have symptoms, and that's how this disease is transmitted. We really need to pay attention to those with underlying conditions, so heart disease, diabetes, lung disease, cancers, and those who are 65 and older. Those are at greatest risk, and so when you're looking at your church population, you really want to be thinking about those people and how do you provide alternative ways of doing church, whether that's online or prayer hotlines, and just having other resources available for them so that they're not getting exposed early on.
So knowing what we know about disease transmission, let's talk about operations as a church and some things we might need to adapt to protect the health of our community. So let's look at from the time someone enters the parking lot until the time they leave. When they first come on your campus, they probably will be greeted maybe by a parking attendant or by a greeter. This is a good thing. For people to know that they are welcome and that they matter is a big value, especially as part of a kingdom family. But some common practices like shaking hands or giving hugs are common ways that we pass on germs. So we might need to think of different ways to greet people. A great thing our volunteers can do is open doors for people. Not only does this show the value of hospitality, but it reduces contact on high-touch surfaces. Your church probably has a common area of gathering, a welcome center. This is a high-touch area. There could be touch screens for sign-ups or for tithing or for kid check. There might be writing utensils such as pens and pencils for sign-up sheets. You might have resources like books or handouts or bulletins. All of these things that are commonly touched, we need to be thinking about and how to reduce the amount of contact. Another thing that you might have is a self-serve coffee bar or refreshments. We really need to rethink how we do this, because that is one area not only do we commonly share with spouts and handles, but we're also putting those things directly into our mouth, a point of entry for a virus. Let's think of some other common practices that we might have to change. as we come together for worship? Communion. Maybe you pass trays. Maybe everybody reaches into the same tray. Maybe you all take a piece of the bread from the same bread. Maybe you drink from the same cup. We really need to be careful with this, especially as taking communion is putting food to our mouth, which is an entry point for a virus. Taking offering, passing the buckets, again, maybe we can rethink how we do offering. Of course, encouraging online giving is ideal. I know at some parts of Africa, people dance up to the front and put their money in buckets. I'm not sure if your church is ready for that yet, but I know you can be creative in thinking of how to collect offering without passing buckets to each other. Worship teams, audio-visual teams, think about things that are commonly shared and make sure to sanitize those, whether it be microphones, keyboards, camera equipment, whatever it is, we want to make sure that we wipe those down. I know that when we pray together, sometimes we like to hold hands as a sign of unity, but this season might not be a good time to hold hands. Maybe we can lift our hands to heaven as a sign of unity instead. We know that for many churches, it's common to pray for each other and to have a ministry time, and that is so important. In fact, the Bible says to pray for one another. And so during this time where we're trying to reduce the amount of contact and close proximity with each other, how do we do that? We can be creative, whether that means the person up front is wearing a mask, or whether that means you're doing prayers online or over the phone. We've heard stories from our local church of people being healed through online prayer services. We believe that our God is limitless, and we also know that you are creative in thinking of ways to minister to each other. Church is going to look a little different. As we come back into our buildings, what volunteers did before might not be the same. And that's okay. We are going to adapt. We are going to find a new rhythm, and God is going to be glorified. We want you to know that we are creating resources for volunteers, policies, and protocols so that your staff and that your volunteers can feel empowered to continue to advance the kingdom of God.
So CDC has released a long list of guidelines to reopen our country and churches and different organizations, and some of them are a little confusing, and we just thought we'd take a minute to walk through some of the guidelines and kind of give you the reasons why and what they might look like in your scenarios, and also what you need to keep an eye on. And so with this, we want to keep three things in mind. The purpose is we want to increase education. So we just did that learning about COVID-19. Increasing education is really your first line of prevention for you and for your congregation. The second is to reduce contact. So this will speak to social distancing and when we talk about those regulations. So thinking about how do you reduce contact between people. The third is to identify the virus. So thinking of those people who are infected who have symptoms and knowing that they're staying home and not passing on the disease. So the CDC really has three categories that you need to keep in mind as a church leadership for the level of protocols that you need to have in place and kind of how you walk through this as a church. So the first is if you have no outbreaks whatsoever. So if you have no cases in your church, you can be a little more relaxed with these regulations. The second category is if you have minimal to moderate cases. So if you have a few cases that pop up in your church over the next few months, I'll walk you through how to report those, but just know that you'll have to put more protocols in place to kind of be a little safer to reduce the spread of those. And the third is called substantial transmission. So if you have more than a few cases, and CDC hasn't outlined the exact number yet, but if you start to get more cases and it turns into an outbreak, it's likely that they'll have you close. One of the ways you can really prepare your staff in the event that you have a case at church or have to do contact tracing is if you develop a core emergency team. And so maybe you want to think of this as 2 or 3 people, and this will vary based on the size of your staff, but if you can get a couple people together, especially those that represent different areas, so maybe a life pastor or a kids pastor or a volunteer leader, just a wide variety of people that come together that are designated as the emergency team, Then walk through these guidelines with them, and they will be the designated people to call the health department if a case arises, or to contact people if they've been in contact with somebody who's infected, and just kind of have those people ready to go if an outbreak takes place in your church. A couple protocols to keep in mind with your staff are thinking of things like, do you know your health department number? Do you have protocols in place if somebody comes to church sick? Are you prepared to hand out masks if somebody is coughing in service? And do you have a policy in place where you are able to rely on that and help people exit the service so that they're not spreading disease? So these are just some things to keep in mind around who to contact, what do you do if someone's sick, and how do you protect the people that are in close contact? We've all been hearing the word social distancing a lot. And this has been changing a lot. Some people say 3 feet, some people say 6 feet. And this is really going to depend on what your state regulations are and what your county even regulates. That can vary. And so it's important to recognize and look up your personal guidelines for your area, because your area might look at square footage of your building. It might look at a certain cap for people. It might look at having a 3-foot radius for a person or a 6-foot radius for a person, or requiring people to wear face coverings. And so there isn't really a general guideline for social distancing right now for reopening churches. So please look at your current regulations for your area. One of the key questions we've been getting about churches reopening is if churches should provide some level of screenings for people coming in their building. And currently, the World Health Organization says it is not recommended to take a temperature to screen for COVID-19. And the CDC also does not recommend taking temperatures alone. So we would not suggest that churches take temperatures of people or try to screen for symptoms. If you do notice somebody sick in the service, you would want to ask them to leave or give them a mask to cover their symptoms. Another thing that you can do for screening is actually on the other side and track your databases. Make sure that your contact information for people is up to date, and that will help you in the long run, because if there is an outbreak in your church or your community, you'll have that information ready to provide so that contact tracing can take place efficiently. When we talk about personal protective equipment, we're talking about goggles, masks, and gloves. And it's important to know your role in this at church and to know what to expect from other people and what your guidelines are. So we're not recommending that anybody wear goggles or glasses to protect their eyes. Masks and face coverings will be determined by your local regulations, whether that's required, and that's also tied to social distancing. So some places might require social distancing, and some might allow you to sit closer if you're wearing a face covering. So look at your local guidelines for that. We don't recommend wearing gloves to protect you from this disease, because those don't really do anything with your entry points. You should be washing your hands. And so we only recommend gloves for people who are working with food products or drinks. It's not only important to be educated about COVID-19 and the symptoms to watch out for, but it's also important to be educated about hand hygiene. And this might seem so simple, but so many of us do this the wrong way. And there was a study that took place and an outbreak that happened in a hospital, and it was so sad, and babies died in the NICU, and they actually traced the infections back to nurses' fingernails. And so their fingernails were harboring bacteria, and it was being passed on to the babies, and it actually caused death. And so by hand washing, when we wash our hands, we need to do it for at least 20 seconds and wash the fronts and the backs and in between our fingers, and even wash our fingernails when we're washing our hands, and our thumbs and our wrists. And so that should take you at least 20 seconds. So when you're preparing your bathrooms at church, you can have hand washing signs, and we'll link some PDFs so that you can print those out and hang them up in your bathrooms. And also make sure that your soap is in stock and that you have paper towels for people to dry their hands after. In addition to hand washing, you can promote using hand sanitizer, but it needs to be in a gel form and at least 60% alcohol, and people need to be using it for at least 15 seconds, so it needs to be wet on the hands for 15 seconds to really kill those germs. As you're walking through these guidelines and thinking about your church members, it's also important to think about your church staff and leadership. And really, how do you empower them to stay home if they're sick as well? And sometimes HR can create policies, and that might be a new sick policy or a wellness policy. And know that Meeting Tense is here to support you if you need help creating policies or protocols for your organization.
Remember, we can keep our values and our beliefs while also promoting the health of our community and protecting the health of the people we serve. It's important that we create a culture where it's okay, even encouraged, to stay home if you're sick. If you're on staff or if you're a volunteer, stay home. I know working at a church, we rely a lot on volunteers, and if a volunteer doesn't show up, it can put us in a bind, but we have to let them know that please stay home, even if it's just a little cough. When we do that and when we encourage that, we're limiting the spread of disease.
This pandemic has really opened a lot of opportunities for the church, I think, to grow and to be thinking of how to reach out to communities and even the world in a new way. And some things to be thinking about with your staff are, how do you create a culture where you can support the single mom who's sick and needs to miss her paycheck and stay home and shouldn't go to the grocery store with symptoms? How can you create a culture where you support that? And if you have licensed therapists or mental health providers in your church, how can you create resources for church members? Because mental health will be a huge need through this pandemic. This is also an opportunity to use these skills that we're learning with hand hygiene and disease prevention, and we can take these to the mission field. So many countries deal with disease outbreaks on a regular basis and don't have access to clean water or soap. And so we can take these skills that we're learning about hand hygiene and help prevent diseases in other countries.
We want to thank you all for watching this video. We hope that it is a resource for you and that you feel better equipped to serve your staff, your church, and your community. Thank you.